A script. Testosterone patches in men. When can they help and what are their risks? Can a testosterone patch improve a man's quality of life? The answer is in some men, yes, but not simply because they have reached 60 or 70 years of age. Testosterone is not an anti-aging supplement. It is a hormone, and when it is administered from outside the body, it affects an entire hormonal system. That is why before using testosterone, we need to answer three questions. Is there really a deficiency? Why does it exist? Do the expected benefits outweigh the risks? In this video, we are going to explain what testosterone patches are, what they contain, how they are used, who may use them, who should not use them, what side effects they can cause, and what we really know about their use in men between 60 and 70 years of age. Subscribe and comment on Integrative Medicine, Soledad del Prado. What is a testosterone patch? A testosterone patch is a transdermal delivery system. This means that it contains testosterone, which passes through the skin and gradually enters the bloodstream. Testosterone administered in this way is intended to replace, at least partially, the hormone that the man's body is no longer producing in sufficient amounts. But there is something fundamental. The patch does not make the testicles produce more testosterone. The testosterone comes from outside the body, and this has consequences for the body's own hormonal system, as we will see later. What does the patch contain? The active ingredient is testosterone, but the patch does not contain testosterone alone. Depending on the manufacturer and the technology used, it may contain different polymers, adhesives, backing materials, substances that control the release of testosterone, excipients. The exact composition depends on the specific product. Therefore, we should not talk about the components of the testosterone patch as though all patches were identical. Different formulations exist, and some use different technologies to allow testosterone to pass through the skin in a controlled way. Why administer testosterone through the skin? The transdermal route has an advantage. Testosterone enters the systemic circulation and avoids the initial liver metabolism that would occur with an orally administered hormone. It can also provide relatively continuous hormone delivery. But there is one well-known disadvantage: the skin. Patches can cause redness, itching, irritation, dermatitis, inflammation, discomfort at the application site. And this is one of the reasons some men discontinue treatment or prefer other forms of testosterone. But when does a man actually need testosterone? Here we come to one of the most important points in the entire video. Being 60, 65, or 70 years old is not by itself an indication for testosterone therapy. A diagnosis of hypogonadism generally requires compatible symptoms or signs, for example, decreased libido, fewer spontaneous erections, erectile dysfunction, reduced muscle mass, loss of strength, fatigue, changes in mood, reduced bone density, unexplained anemia. But these symptoms are not specific to low testosterone. Diabetes, obesity, certain medications, depression, sleep disorders, chronic diseases, and many other conditions can cause similar symptoms. Confirmed low testosterone. It is not enough to perform a single testosterone test at any time of day. Guidelines recommend measuring testosterone in the morning and confirming a low level with a second measurement when appropriate. And then we need to investigate, why is the testosterone low? What can cause low testosterone? There may be a problem directly affecting the testicles. This is called primary hypogonadism. But there may also be a problem in the system that regulates the testicles. Hypothalamus to pituitary gland to testicles. This is called secondary hypogonadism. There are also potentially reversible causes. For example, obesity, certain diseases, certain medications, sleep disorders, metabolic diseases, excessive alcohol consumption, pituitary disorders. That is why testosterone should not simply be used to increase a number on a blood test. Who may benefit? Men who have compatible symptoms plus consistently low testosterone plus a medical evaluation showing that testosterone therapy is appropriate. In these men, testosterone replacement therapy, or TRT, can improve certain aspects of androgen deficiency. These may include libido, sexual function, muscle mass, anemia associated with hypogonadism, bone mineral density, but not every symptom necessarily improves, and testosterone is not a general treatment for aging. How is a testosterone patch used? Here we need to be careful. There is no single universal protocol for every testosterone patch. The dose, application site, and replacement frequency depend on the specific medication. In general, the patch is applied to clean, dry, intact skin, following the instructions for the specific product. It should not be applied to irritated skin, wounds, inflamed areas, and it should be replaced according to the interval specified for that particular medication. Something very important, a patch should not be cut, altered, or manipulated to try to change the dose, unless the manufacturer specifically states that the product can be modified in that way. The dose should be adjusted through medical monitoring. What is monitored during treatment? This is where TRT stops being simply, I put on a patch and that's it. Medical follow-up is necessary. Doctors may monitor testosterone to make sure the concentration remains within the intended therapeutic range, hemoglobin and hematocrit, because testosterone can stimulate red blood cell production. If hematocrit becomes too high, the risk of complications increases and treatment may need to be modified or temporarily stopped. Prostate and PSA, particularly depending on age, medical history, and individual risk, blood pressure. This is especially important because testosterone products can increase blood pressure. Other things may also be monitored: symptoms, side effects, sexual response, edema, changes in sleep, and other parameters depending on the individual patient. Who should not use testosterone? There are situations in which TRT is contraindicated or requires particularly careful medical assessment. These include known or suspected prostate cancer. Testosterone should not be started without appropriate evaluation. Male breast cancer, this is another important contraindication. Elevated hematocrit, because testosterone may increase it further. Severe untreated obstructive sleep apnea, this needs careful assessment. Uncontrolled heart failure, this also requires particular caution. Desire for fertility, and this is extremely important. Testosterone and male fertility, there is a paradox here. A man may have low testosterone and think, I need testosterone to improve my sexual function. But if he wants to have children, external testosterone can actually work against that goal. Why? Because when we introduce testosterone from outside the body, the brain detects that there is enough hormone and reduces LH and FSH. As a result, the testicles may reduce their own testosterone production and also significantly reduce sperm production. Therefore, TRT is not a treatment for male fertility. For a man who wants to preserve fertility, the approach is different. Side effects. Side effects can be divided into local and systemic effects. At the patch application site, irritation, redness, itching, dermatitis. Throughout the body, possible effects include acne, increased red blood cell production, edema, increased blood pressure, increased estradiol, gynecomastia in some men, worsening of certain sleep problems, suppression of LH and FSH, reduced sperm production. And this brings us to a particularly interesting question. What happens to estradiol? Testosterone is not an isolated hormone. Some testosterone can be converted by the enzyme aromatase into estradiol. Therefore, a man receiving testosterone may experience an increase in estradiol. In some men, this can contribute to breast tenderness, gynecomastia, fluid retention. But male estradiol is not simply a bad hormone that needs to be eliminated. It also has important functions in bone health, sexual function, metabolism. Therefore, there is no reason to systematically try to eliminate estradiol in a man receiving TRT. What happens to the prostate? This is one of the questions that concerns men the most. Testosterone can modestly increase prostate volume and PSA in some men, but we need to distinguish between two things: stimulation of prostate tissue and causing prostate cancer. Current evidence does not demonstrate that TRT causes new prostate cancer, but that does not mean we can ignore the prostate. That is why appropriate assessment is performed before and during treatment. What happens in a man aged 60 to 70? Now we come to the central point. Imagine a 65-year-old man. He has compatible symptoms. 2 morning blood tests show low testosterone. The cause has been investigated. He has no major contraindications and he starts TRT. What might happen? Testosterone levels increase. That is precisely the objective, but more does not mean better. The goal is not to achieve bodybuilding level testosterone concentrations. The aim is to reach an appropriate physiological range for the individual patient. Libido and sexual function. This is one of the areas where the evidence is relatively consistent. In men with confirmed hypogonadism, TRT can improve sexual desire, sexual activity, spontaneous erections, but the response varies between individuals. And improving libido is not the same thing as curing erectile dysfunction. Erectile dysfunction can involve vascular plus neurological plus psychological plus metabolic plus hormonal factors. Therefore, testosterone is not a universal solution for erectile dysfunction. Muscle and strength testosterone can increase lean body mass, muscle mass, but we need to distinguish more muscle from more functional strength. The effects on strength can be smaller and more variable than the increase in lean mass. Therefore, TRT does not replace strength training plus adequate protein plus good nutrition plus sleep, visceral fat. In men with hypogonadism, TRT can produce a modest reduction in body fat and visceral fat and increase lean mass. But again, it is not a weight loss treatment. And in an obese man with low testosterone, losing weight may itself improve testosterone levels. Therefore, the underlying metabolic cause also needs to be addressed. Glucose and insulin sensitivity. This is a particularly interesting issue. Some studies show improvements in insulin sensitivity, glucose levels, body composition, but the results are not sufficiently consistent to use testosterone simply as a treatment for diabetes. Therefore, TRT is not a diabetes treatment. If a man has diabetes and low testosterone, there may be additional metabolic benefits, but the indication for TRT remains hypogonadism, not diabetes hematocrit. This is one of the most important adverse effects. Testosterone stimulates erythropoiesis, the production of red blood cells. It can increase hemoglobin to hematocrit. In some men, the increase can be excessive. When hematocrit becomes too high, treatment needs to be reassessed. Therefore, blood testing is essential. What about the heart? Here, we need to forget the simplistic headlines. For years, there has been considerable controversy over whether TRT increases the risk of heart attacks and cardiovascular events. One of the most important studies is TRAVERSE. It included more than 5,000 men with hypogonadism and elevated cardiovascular risk. The primary result did not show a significant increase in major adverse cardiovascular events compared with placebo. But there is a fundamental warning. TRAVERSE used testosterone gel, not patches. Therefore, we cannot say TRAVERSE proves that testosterone patches are safe for the heart. It does not. It shows that under the conditions of that trial, testosterone replacement using a gel did not significantly increase the risk of the primary cardiovascular outcome. In addition, some specific safety signals require clinical consideration, and testosterone can increase blood pressure. So, is TRT safe for a 65-year-old man? That question is not quite the right one. The better question is it reasonably safe for this particular man with this specific diagnosis, this dose, these medical conditions, and this level of monitoring? A healthy 65-year-old man with confirmed hypogonadism who has been properly evaluated is not the same as a 65-year-old man with mildly low testosterone, obesity, severe untreated sleep apnea, elevated hematocrit, and non-specific symptoms. These are two completely different patients. Patch, gel, or injection. There is no perfect option. Patch advantage, relatively continuous hormone delivery. Problem, frequent skin irritation. GL advantage, easy administration and dose adjustment. Problem, the possibility of accidental transfer to another person through skin-to-skin contact injections. Advantage, they do not require daily or continuous application. Problem, depending on the formulation, they can produce greater fluctuations in testosterone levels and require injections. The choice should be individualized. Conclusion. So what should we remember? Testosterone patches are not an anti-aging treatment. They should not be used simply because a man is 60 or 70 years old. A medical indication generally requires compatible symptoms plus confirmed low testosterone plus investigation of the underlying cause. When true hypogonadism is present, TRT can particularly improve libido, sexual function, lean body mass, bone mineral density, and anemia associated with testosterone deficiency, but it can also cause erythrocytosis, skin problems, increased blood pressure, edema, acne, suppression of the body's own hormone production, and reduced fertility. And it requires medical monitoring, and perhaps the most important sentence in this entire video. Testosterone is neither inherently good nor bad. The question is whether that particular man truly has a deficiency that justifies replacing it, and whether the benefits outweigh the risks. And in men between 60 and 70 years of age, the available evidence indicates that there can be benefits when confirmed hypogonadism is present, but it does not justify using testosterone as a general treatment for aging. Recommendations regarding TRT vary depending on the country and the specific medication. The dose and replacement frequency of a testosterone patch should follow the product information for the prescribed medication rather than a general protocol found on the internet. This content is for educational purposes and does not replace medical diagnosis or prescription.